Most people can do something for themselves to stay fit, active, and able to remain independent for as long as possible. Keeping healthy and well is not just about physical exercise. Feeling low or lonely or having poor mental health can be as bad for you as being physically unfit. There are lots of things to do in Bracknell Forest, whether that's going out for a walk, doing something to keep your mind active, or just seeing family and friends to make sure you don't become isolated. Self-Care Week is a week-long event that happens every November. In 2014, staff from Adult Social Care worked with staff from the NHS and other organisations like the police, the fire service, Local Health Watch and the voluntary sector to talk to local people about their health and well-being. People were also offered health MOTs for the body from a healthcare practitioner. Professionals were there to provide advice about maintaining a healthy weight, not drinking too much alcohol and how to stop smoking.
I thought Self-Care Week was a fantastic opportunity to try something new. So I went along to the Zumba class and it was really fantastic.
You get to a certain age and you realise it's time to start looking after yourself. So I attended one of the mobile health MOTs and they were doing blood pressures and just giving advice on how to keep fit. And from that I decided that I would do some skipping.
Keeping healthy is absolutely crucial for general well-being, for managing stress, for managing daily life and for feeling good about yourself as well. So highly recommended.
And that wouldn't have happened without something like Self-Care Week, because sometimes you don't want to join a gym, but you do need that little motivation to get you to do things.
The council has a falls prevention advice service. The wellness coaches visit people at home to give them advice and information about how to avoid a fall. They may advise people to visit the optician or ask a pharmacist to review their medication. They can refer people to strength and balance classes where they can do exercises to prevent falls. The Rapid Assessment Community Clinic, based at Bracknell Health Space, offers a real alternative to going into hospital. Rapid assessment and treatment is tailored to meet the needs of older people with complex health needs, such as those at risk of falling. People can be referred by a GP, physiotherapist or district nurse, so that in most cases people can be seen locally without having to go to hospital. Sometimes people can become unwell and the support of others is needed to get better. Intermediate care in Bracknell Forest is provided by Adult Social Care with the NHS. There are a range of services such as support at home, physiotherapy and equipment loans that help people stay at home rather than having to go into hospital, and can also help those who have been in hospital to get back home.
Well, before Dave actually came home from Frimley Park Hospital, there was a meeting arranged between the social services team and the hospital as well.
And when I went home, they'd arranged carers to come in, and that service was marvellous.
They was really worried how I was going to manage it when I come out of the hospital. So
yeah. So it's all very reassuring, really. We knew everything was being set up.
When I came out of hospital, I didn't feel confident, and having the carers come in gave me that confidence.
Well, they were coming initially about 4 times a day, and double up help. Carers were coming in, 2 carers at a time initially to help with Dave's personal care, and also with helping him with exercises in the afternoon.
It gave me confidence to know that someone was coming of a morning and make sure I was all right, and that again in the evening, because some days you don't feel so well, but I knew that someone was coming, and they, as I said, they were a great help.
It's really helpful to know that health and social care people are working together, because if we have any problems at all, then all we need to do is pick up the phone and ask for help.
Sometimes people need an advocate to be able to say what they want. An advocate is someone who can help people to understand information in order to make decisions about their lives and speak about things that are important to them. Be Heard is a self-advocacy group for people with learning disabilities in Bracknell Forest. The group meets every week and is supported by an advocate to speak out for themselves and others.
I really enjoy coming, made lots of friends. Rob sometimes makes me a cup of tea.
I'm the advocate of helping me to meet different people in different places, and eventually I found some friends I wanted to live with, and now I live with them and it's worked out.
And they're all very nice people. I enjoy going to the group.
It's made me feel happy and cheerful to meet up with some nice people.
Be Heard is all about all together and we can meet up.
Staff from Adult Social Care also support carers in their caring role. A carer is someone who provides informal support to an adult, for example a parent, another family member or a friend.
Well, my husband was diagnosed with Alzheimer's and Parkinson's 3 years ago. I didn't know how to deal with my husband at times, the forgetfulness, paranoid about closing doors, all sorts of silly things. They sound silly, but it kind of gets a big deal when you're trying to look after somebody. Being able to talk to a dementia advisor was the most important, because I knew I had somebody at the end of the phone that I could ring up, and when things got bad, and I got quite a lot of advice from her.
I have found that going to different groups and organisations, I get information to help me and other carers. I go to the council for certain things. I go to a lunch that they run, and there you can see people from other organisations, people from the council and other carers. They can help you with just simple things like, I can't get someone to eat, I don't know how to use the wheelchair properly, you know, and they'll advise you and you can get help like that.
The support I received from the psychologist was absolutely brilliant. He made me see things in a completely different way, that none of it was my fault, the guilt that I was feeling.
Carers' lunches are absolutely brilliant. As a carer myself, I always say, if there's nothing else you can do, you should try and get to a carer's lunch, because you will meet lots of different people, people that have got the same sort of caring role as you. You'll meet other carers.
There are many sources of advice and information to help people to stay independent. Staff work with a wide range of different organisations who provide specialist advice, for example My Care My Home, who provide advice to people who fund their own support. The Council also produces the Helping You Stay Independent guide, with information on how to become and stay independent. Another way to find information about support and activities is by browsing the Adult Social Care iHub. The iHub is an online directory of services and events in the local community. The guide is a useful resource for anyone who lives or works in Bracknell Forest, and can be accessed by visiting the Bracknell Forest website and searching for iHub. To find out more about adult social care, please visit the Council's website www.bracknell-forest.gov.uk or call 01344 352 000 and ask for the Joint Commissioning Team.